Welcome back. So we went over the beauty of how the heart controls, how the heart's only job and all the heart really cares about is controlling blood pressure when you start exercising or when you're not exercising. It doesn't want your body to explode or your vessels to explode because the pressure is too high. And we also talked about how its other goal is to supply blood to its muscles so you can keep exercising. Ultimately, it chooses blood pressure and making sure your body doesn't explode over the need to exercise, which is a good choice. But we talked about how the stroke volume and cardiac output increases with the Frank-Starling mechanism and all that good stuff when you start exercising, but we really didn't talk about yet what causes the vasoconstriction and vasodilation. So we know how we increase the blood flow, the Frank-Starling mechanism, venous return, everything, heart rate increases, acetylcholine, epinephrine, everything. But we didn't talk about what actually makes. We know it's vasodilation, vasoconstriction. When we start exercising, more blood flow goes to the muscles, makes the muscles happy. Blood flow constricts or decreases to less active organs such as the GI, the kidneys, everything. But we didn't really talk about what is causing this vasoconstriction, vasodilation. So we'll touch on that very, very quickly. So basically, we know at rest we have acetylcholine, which is slowing down the heart, and that's innervating the heart via the vagus nerve. Acetylcholine is also called the parasympathetic activity, slowing down the heart rate. And when you start exercising, you release epinephrine, and this is via the sympathetic nervous system, so SNS. And this speeds up the heart and does all that good stuff. But what it also does is it causes vasodilation. Now it's very confusing because this causes vasodilation in some arteries, or causes them to get bigger, and thus increase the blood flow to certain areas, but it also causes vasoconstriction in other arteries. Now this depends on the receptor of the arteries. So epinephrine causes vasodilation in the arteries leading to the muscle, because in the muscle it acts on the beta adrenergic receptor. It's called beta-an. So the beta adrenergic receptor causes vasodilation when epinephrine acts on it. Now it causes vasoconstriction in everything else except the muscle organs, so all the less active organs, because it acts on the alpha adrenergic receptors, or alpha-an. So really it depends on the receptor for epinephrine. So that's what causes vasodilation and vasoconstriction. Epinephrine also speeds up the heart and increases contractility like we went over in the last video, but it also causes vasoconstriction and vasodilation. So epinephrine is pretty cool. That's why it's called adrenaline. That's why everyone loves it. It's pretty cool. That's why they give it to patients in the hospital and everything. So now we'll enter the next question about blood pressure and what exactly is blood pressure. How do you measure blood pressure? Why do we care about blood pressure? And why do we care about blood pressure? So here's a picture of me taking some random person's blood pressure, and they take blood pressure with a stethoscope. This little guy. And do it again. That little guy's a stethoscope. This cuff is just called the cuff. And essentially what this does is, okay, so everyone knows what pressure is. It's essentially the same thing with blood pressure. You have an artery, and you have this blood. The blood will be in blue. Not really. Okay, that's not really good. It's not really a good picture. Okay, you have your artery. We'll draw the artery in black. It's a tube, and essentially, and you have your blood, and your blood's in red. Now, when blood is flowing through the artery, it's pushing against the walls, depending on how much blood there is. But it's an enclosed environment. Just like when water is flowing through a hose, it's pushing against the wall of the hose. And that creates a certain pressure. And this pressure that's felt on the arteries, or veins, but in this case the arteries, is called blood pressure. That's the pressure of the blood in the arteries. Now, that's pressure. Now what this little guy does, this stethoscope, or this cuff, what it does is you put it on the vein, you put it on the arm, and the artery that the stethoscope you're listening to is called the brachial artery. It's not important, but the brachial artery is one of the most prominent arteries running through your arm, so it's a very good, because it's visible. You can easily put the stethoscope and hear it. It's a very good artery to use. Now what the stethoscope does, or what the cuff does, is you inflate it to a certain pressure, and when you inflate this cuff, what it actually does is it occludes the artery, which means it cuts off blood flow. So how this is normally would be, blood's flowing through the vein. When you increase the cuff to a certain pressure, it occludes it, so it actually cuts off blood flow. which is why if you leave this cuff on for an extended period of time, your arm will start getting very, very cold and blue and eventually fall off. I don't know about fall off, but it will not be good. So it includes the blood flow. And that's what the cuff does. And as you relieve the cuff and decrease the amount of air in the cuff, you very slowly let blood go back through. Very, very slowly. And when it goes very, very slowly, you can actually hear it with the stethoscope. Stethoscope increases your hearing like 10,000-fold, and you can actually hear the blood hitting the artery as it slowly goes through it as you let it open. And that very, very first sound you hear is called systolic blood pressure. Systolic, we call it SBP, systolic blood pressure. And so that's the strongest systolic blood pressure. And the very last sound you hear is called diastolic blood pressure. Diastolic blood pressure. That's why you have 2 readings when you get blood pressure. And what these numbers actually mean is systolic blood pressure is the pressure in the arteries upon the contraction of the heart. So when the heart contracts, I don't have a picture of the heart, the drawer, can't draw it that fast, but when the heart contracts, essentially, it propels blood throughout the aorta and throughout the artery. And the highest pressure it records is called systolic blood pressure because it just pushes it through the artery and it causes a pressure, very high pressure called systolic blood pressure. Diastolic blood pressure is the pressure in the heart when the heart is resting. So that is when the heart is filling up with blood via the Frank-Starling mechanism and diastolic volume. That's the pressure of the arteries. Very low. It will be very low. And we'll clear it. That is in the normal blood pressure is 120/80. Remember, this is systolic, this guy. This is diastolic. Systolic is always going to be higher because that's the pressure when you're pushing out blood when the heart is first contracting. It'll be much higher. That's normal blood pressure. Now, say you have a blood pressure of 160/110. That's pretty bad. So, what this 160 means is that's the pressure of the blood when the heart contracts. Now, the heart can still withstand it, but that's very high pressure, and over time, the vessels habituize to this high pressure, and that's not good at all to the vessels, because the heart, just like any single muscle, when your muscle is going against a pressure, it gets bigger. Well, in the heart's case, this is not good, your heart getting bigger, because the walls of the heart get bigger to push out that higher pressure. And that's not good. Essentially, you got the little heart box. And essentially, the left ventricle is very, very strong and much bigger than the right ventricle because it pushes blood throughout the whole body. And so when it's pumping pressure of 120, that's fine. But when it's 160, the walls actually get bigger of the heart. And this is more of anatomy of the heart, not very important. But the walls get bigger, and thus the heart does get stronger, but the walls get bigger. And as the walls get bigger, less blood can enter the left ventricle. And if less blood can enter the left ventricle, you can ultimately push out less blood. It's getting more into more exercise testing and heart disease and everything. That's not too important. But just know this is systolic blood pressure. And now, what else about blood pressure should we talk about? Oh yeah, when you start exercising, of course you're going to increase your systolic blood pressure. Just common sense. If systolic blood pressure is the pressure of the heart when it contracts, and it's 120. When you start exercising, you're going to increase. You increase the blood flow throughout your heart. Your cardiac output increases, so you're going to be pumping out much more blood. So it's very normal for this to increase to like 180 or 200 when you're exercising. Now, if it gets more than that, that's obviously not good. But so your systolic will increase when you start exercising because you're pushing out more blood. There'll be more pressure. Now, your diastolic would actually stay the same when you're exercising or increase slightly. The reason being because this is the pressure when your heart's resting. Well, when your heart's resting, regardless if you're exercising, it's going to be the same exact pressure, hopefully, in a healthy heart. So diastolic volume wouldn't really increase. So that's blood pressure. Another thing that goes blood pressure, kind of going with the need to control vasodilation, vasoconstriction. Say this is a normal artery. You have your pressure. You have your blood hitting the walls, creating a certain pressure. Well, that's a pretty high pressure. Let's give that a random number 120. Now, say you have vasodilation, which happens when the epinephrine binds to the beta-adrenergic receptors going to the muscles. So you have a vasodilation. So the artery gets bigger, and when that happens, you still have the same amount of blood flowing through it, but since the wall is bigger, pressure will be less. So say pressure is 120. Pressure is less, but now you have more blood flow going to the organs or to the muscles. But the arteries to the less active organs vasoconstricted. And when you vasoconstrict, you increase the pressure, so now pressure, say, is 140 in there. So that's how the body controls blood pressure. Vasodilating in one part, vasoconstricting in another part. So now the very last part we'll go to is this really confusing diagram. So you have this really confusing diagram. And all this is showing is that the brain controls the heart, which we know that brain controls everything. But there's an area in the brain, in the medulla oblongata, called the Cardiovascular Control Center, or CVC, or CR. These really mean the same thing. CR means Cardiovascular Control Center, or Cardiovascular Control Center. What this means is the heart, the brain, the medulla oblongata, controls everything that the heart does. It controls the regulation of blood pressure. Ultimately, it's the major player in everything. So obviously, we know that if you cut out your brain, you die, because you can't control anything. But your heart will still beat because it's autorhythmic, and the SA node beats by itself. But you can't control vasodilation or vasoconstriction. You can't have all that stuff. So, what this thing is, you can't really see. Do this in black. Draw it again. This confusing diagram. This is the parasympathetic nerve. This is just showing that vagus nerve going to the heart. That's what slows down the heartbeat, slows down the heart, slows down contraction through acetylcholine. Some of these things I can't really see. Don't know what this is. But this is just showing really the cardiovascular control center really controls when the heart speeds up, controls when the heart slows down. Obviously epinephrine and acetylcholine control that, but the cardiovascular control center is the major dude. Controls everything. He's like the big boss, big honcho. So, we'll just continue this again through microcirculation of blood flow through the arteries. When you exercise, you release certain byproducts, such as CO2, heat, lactic acid, which we'll just abbreviate as this, lactic acid, or hydrogen ion. These cause the capillaries to relax, the sphincters to relax, and thus you increase the blood flow through the capillaries. Just mention it because that's also pretty important. It's called the auto-regulation of blood flow. So this is really, all this finishes the section on the cardiovascular center. So again, very confusing diagram. Brain controls everything. Me taking someone's blood pressure, explaining what blood pressure is. Very confusing diagram.